is Axel, and the reason I'm here today is because I'm infected with Hep C, and healthcare should be the right.
Gilead is killing people with Hep C. Gilead is killing people with Hep C. Gilead is killing people with Hep C. Drop the price! 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 That is killing people with Hep C. Don't touch me. Gilead is killing people with Hep C. Gilead is killing.
Kill sauce pennies! Green Cross Live! Hi, my name is Axel. I'm from Nairi. I'm also affiliated with Vocal. I don't think anyone that doesn't have the means shouldn't have the right to live. You know, it's really bad what they're doing. You know, I know they can make a generic version that costs much less, so they can have a cure for everybody. I'm infected with Hep C myself, and I think it's horrible what Gilead is doing, and it's just plain greed. You know, and it's a shame that people don't have any compassion with people with illnesses. All they're doing is making profits off of people's sicknesses, and it's just disturbing, you know?
That ain't right!
I don't know how they sleep at night. Thank you.
Hi, I'm from Acton, New York, and we're here supporting the demonstration demanding the reduction of the price of Sovaldi. I just want to say that last week, a reporter asked me, why is Acton getting involved with hepatitis C? You guys are the AIDS coalition to lose power. And the specific answer is that 25% of people living with HIV are co-infected with hepatitis C, and it's a cause of morbidity and serious complications. And even though the guidelines for Sovaldi say that people with co-infected with HIV should be on second line to receive the treatment, they're being denied the treatment because they're not at the top of the hierarchy. That is unacceptable. And we're going to stay here, we're going to stay on this fight until Sovaldi reduces Gilead reduces the price substantially so that people can access it. And if not, we're asking the federal government to break the monopoly on Sovaldi and distribute it to a reasonable price to Medicaid and to all the people that need it. Thank you.
Here's a fact. Experts have shown that Sovaldi, Sofosbuvir, can be made for $100 for 3 months. Gilead is charging $84,000 for
That ain't right!
That's outrageous profiteering, and we cannot stand here and accept this. 185 million people globally have hepatitis C virus. In the US, I think it's something like 35 million. We're going to bankrupt our governments. We're going to bankrupt our state insurers. We're going to bankrupt every single payer. And most people with Hep C have to pay out of pocket, and they can't afford $84,000. This is outrageous.
Michael Tequili, I'm from Health Cap. We're here to protest the pricing of Gilead's drugs, Sofosbuvir or Sovaldi. They're currently charging $1,000 a pill. We're actually giving a speech inside at the New York Plaza Hotel, probably telling everyone how great the drug is and the fact that it's a cure. Yeah, it's a cure, but if you're poor, you can't afford it, and I don't think it's right. I think medication should be available to everyone and not just the rich. And so we're here with Vocal New York and TAG and other groups to say that Gilead needs to do the right thing and lower their prices so that everyone can have access to this amazing drug. We can actually see the end to Hep C if they would simply stop caring so much about greed and profits and start caring more about the lives of people. There are people who can't wait that long to pay for this drug, and so I think they need to do the right thing and lower their drug prices so that everyone can afford this drug.
We have an ACT UP member who's a veteran, and he's been told by the Veterans Administration that his hepatitis C has to advance before he can get Sovaldi, the best treatment there is for it, because it is too expensive for the Veterans Administration. Now you have to remember, the Veterans Administration is the entity in the United States that is getting the biggest discount on Sovaldi. So you can imagine how few people are going to get it in private insurance policies that aren't so very good. People with low wages, people who are paying for their own insurance because they're self-employed. If the people who are most likely to get it are being told your disease has to advance before you can get the cure. Imagine what's happening across the country.
They said we'd be back, but I might not be able to come back because I'm sick with hepatitis C and I can't afford $1,000 bill. It's killing me.
It's the same story over and over and over again, year after year. Pills cost penny, greed costs lives.